All right, this is TIDieR Y1, Peroneal Tendinopathy. The article I found talks about a 40-some-year-old lady who she increased her exercise activity, wasn't able to keep up with it due to pain on the lateral aspect of the ankle. So this article by these authors discussed a manual therapy protocol to help with peroneal tendinopathy. On the whiteboard, we have our 6 interventions that we're going to walk through, and we will demonstrate them now. Alex is going to play my patient. So the first intervention that we have is the calf stretch. So Alec, do you want to go on the wall here? The protocol stated that they want the knee flexed and extended, going for 30 seconds each. And this exercise was also included in the patient's home exercise plan. So Alec is obviously a lot more gifted than a 40-some-year-old lady, but as you can see, his knee's flexed here, and that's what we're going for. All right, that's good. So let's hop up on the bench here. So another thing that we were working on is fibularis longus and brevis, that whole lateral compartment strengthening. So in order to do that, we're going to go into plantar flexion and eversion. So Alec, what you're going to do, you're going to hold the band there, and then you're going to start up and in, and what I want you to do is pull down and out, just like that. Just like that, nice and slow. Again, strengthening the lateral compartment of the lower leg. This was 3 by 10. 3 by 10. And as she progressed through visits, they used more resistant TheraBand, and it was tolerated well. Okay, that's good there. So now let's lay on the bench here on your back with your foot hanging off the table. No, we'll start this way first. So another thing they worked on was regaining dorsiflexion, range of motion, because as you go into dorsiflexion, there can be strain on these plantar flexion tendons. So they just did a posterior glide of the talus, this talocrural joint here. So into 4. Quick oscillations at the end range. AP direction. Just like so. Okay, so after that was done, another technique that they used was called a grade 3 lateral glide. There's a photo included in my TIDieR on how this is done, but essentially, since it's weird, if you look at it, it's a concave on convex relationship here. So you take it here, take the calcaneus support proximally, and just a slow and gentle grade 3 mobilization laterally. Medial to lateral. Just like so. Grade 3, not to end range. Just nice and slow, like that. And this seemed to help alleviate the patient's pain when this was done. Okay, next exercise, Alex, do you want to stand up? Was a unilateral heel raise. It doesn't specify whether or not the patient had support or unsupported, but it just said go up on one heel and come back down on that same heel. So that was 3 by 15 or 3 by 10 in the protocol as well. Just like so. And then one of the outcome measures that they used to evaluate the pain and the quality of the motion was the anterior reach from the STAR excursion balance test or the Y excursion, either one. And all that required was the patient to be on their unaffected leg, or no, on their affected leg, sorry. So Alex's left leg is affected here, and to reach forward as far as they can. Go, go, go. Okay, he could do that. The patient could not go that far, but he could. And that was to assess quality of motion, just the anterior portion for dorsiflexion, and yeah, just stretching of those tendons. So yeah, any questions, feel free to ask. If not, Tiger's back, won the Masters. Today's a great day.